Hey, Assalamu alaikum, everybody, and welcome to Women's Health Matters. We were really excited to have an in-person day where we can kind of meet up at the park and talk about heart health. But the weather and everything, there was just things out of our control that made us have to postpone. But we're excited to bring this conversation to you finally. I think it's a really important topic. We're talking about heart health today. And I'm Sadaf, the executive director of MWO, and I'm really excited to have Sadia, who is our Women's Health Matters coordinator, along with Dr. Sumbal Sattar, who is a local pediatric cardiologist. So I'm going to let you all introduce yourselves and then we'll get right into it. So Sadia, can you tell everybody a little bit about yourself and your background?
Yeah, sure. Assalamu alaikum, everybody. I'm the coordinator for Women's Health Matters. I have a background in health and psych, anything in health and psych. I'm also a licensed hijama practitioner and have my own clinic and practice holistic health as well.
Thank you so much, Sadia. How about you, Sumbal? Can you tell everybody a little bit about yourself?
Assalamu alaikum. I'm Sumbal Sattar, and I'm a pediatric cardiologist here in Orlando. I have my own practice, Kitty Cardiology, and I've also been working for several years with the American Heart Association in their Circle of Red division here locally.
Thank you. That is so awesome. And before we get started with this conversation, I wanted to just do a little bit of a disclaimer. This is just purely for educational purposes. We are not diagnosing anybody's illnesses or telling you, you know, to do or not do something when it comes to your own health. And that's something that just is between you and your physician. So this is more just things that you need to think about when it comes to your heart health. And I would love Sumbul, like is it okay if I call you Sumbul? I could call
Yes,
you Dr.
please. Oh,
Sattar.
yes, please. No, please.
You're calling
Yeah.
me Sumbul. Okay.
Yeah.
I think when it comes to all these events that are going on, Circle of Red, or in I think February is, Heart Month.
It was Heart
So
Month.
please do share. And I think it's so important for Muslim women to learn and be in those spaces. Sometimes Muslim women don't necessarily show up to a lot of these
Yes.
incredible programs that are
Hmm.
happening. And we
Yeah.
would love to just amplify whatever is going on so we can be there
Yeah.
and learn from it. We don't have to have our
Yeah.
separate conversations if they're already happening in the community.
Yeah, and it's multifaceted also because in our community, I don't think a lot of people are aware of the resources and the organizations involved and opportunities to volunteer. They have everything from food banks to, to lectures and, obviously I think most people have heard about the Heart Walk that I know the
Yeah.
MWO supports every year. But they have like multiple events like that, which I think our communities show up more in. You very, like you said, very rarely see our faces in those organizations. And so I did drag in a few girls from our community this time to our big luncheon during Heart Month in February. Also because I wanted them to also in that, to promote their businesses too, because there's sponsorships and stuff that they do there. So not only for the educational and to support a great cause, but also to support their businesses and
The
to get
network.
Muslim businesses out there
Yeah.
in these areas as well.
Yeah.
Um, so I did actually inform multiple local businesses to see if they want, and then so that they could get their names out there, in even small sponsorship auction items, things like that, just so that people get, you get into that community as
Yeah.
well.
And we're living
um,
in this community, right? Like, I
yeah,
think staying apart really
yeah,
limits what we can
absolutely.
do and our resources.
Absolutely, absolutely. So I think it's
So
super
that's
important
amazing.
that we look outside of our own little circles and kind of delve into these others for many reasons, even just for the interaction with people who may not have been around a Muslim woman before or
Oh,
things like
yeah.
that. It's so impactful, especially when you're doing something positive and to be seen in that positive light,
Yeah.
as strong, educated, compassionate, philanthropic women, I
Which
think
Muslim
it's
women
super important to
are.
get
They
them.
really are. We see them
Yes,
every
that's who
single
we
day.
are, but people
Yeah,
don't see us in
yeah,
outside of our own communities. We're
exactly.
so focused on ourselves that I think we really do need to delve out
Yeah.
into these other communities so they get exposed to us and who
Yes.
we are,
And that's why I really love that you're part of this Go Red campaign. I think it's such an important place
Yeah.
for you to be, right? I
Yes,
think to
yes,
represent our community, but also bring back that
yes,
knowledge to us. So I
absolutely,
think it's
absolutely.
awesome.
Yeah,
We're gonna just jump right into
yeah,
the topic at hand. I wanted to first ask about let's start from the beginning.
mhm,
Prevention, right?
yeah,
I think for so many women, it's always too late by the time
yes,
they're already sick. They've had a heart attack. They've been diagnosed with, they have high blood pressure. Whatever is happening, it's already happened. So let's talk a little bit about prevention
yeah.
first.
So,
Um,
I think with prevention, I think in medicine, I think one of the more neglected things that we focus on because, let's face it, it doesn't make money,
it doesn't. Yes.
and so a lot of our research, a lot of our education is more on the actual disease and then the treatment,
Yeah.
because that's where the pharmaceuticals come in.
Yeah.
That's where the money is, right? It's only recently that I think, and over several years, and in fact, in the third world countries, it's even worse because over there, sadly, that exposure is so limited to prevention and screening guidelines and things like that, that I think it's so key to start there, even with counseling with your doctor and stuff, to ask your doctor questions on, hey, I have a family history of this. Is there anything you think I should be doing or should, be checking on a routine basis so that I cannot get to where my grandmother got,
Yeah.
so I think those are such important aspects that are frequently ignored because we feel good. So we don't want to do anything about
Yeah.
anything because we feel good, So
And I
a
think
lot of
also,
people,
we
yeah,
don't talk
ignore.
about our family history to each
No,
other. Like, I
no.
haven't had a conversation with my grandmother about a
Yeah,
lot of things, right? And I think, um, do we talk to our children who are growing? Like, I have adult daughters now,
correct.
but have I really sat down with them and talked to them about what my dad went through,
Mhm.
who had high
Yep.
blood pressure, who had heart disease? We don't.
Yeah. No,
And
we don't.
I think
No.
those conversations need to happen before you even step into a doctor's office.
Correct. And I think it has to be actually your focus of those annual visits are for those reasons,
Yes.
okay? So when you go in for your physicals, that is the whole purpose, is prevention. The reason why you're getting yourself checked. You feel fine, but you're still getting your exam done, you're getting maybe some blood work done, things like that is prevention. And so you really need to make the most of that visit, and the biggest help you can give your doctor is by giving a very clear family history to your physician. You may not think it's important, but I think it's always worth mentioning, So if someone passed away young, from a condition, please mention that condition, so that at least your doctor can then decide, hey, you're not going to just need a routine physical here. You're going to need this, this, and this,
Yeah.
And so one of the biggest things is cardiovascular disease that people ignore, and women are the most neglectful of themselves. They're more focused on their kids and things like that. So I feel like women should absolutely take seriously any history of cardiovascular disease in their family, whether it be, hyperlipidemia, high cholesterol, things like that. If there's diabetes, if there's hypertension, if there's early onset heart failure in the family and any family members, if someone has a pacemaker or defibrillator in their family, if someone's died young, so usually we discuss, if you've had any family member in your immediate family die below the age of 40, 50, that's a significant history you really do need to mention to your primary care doctor, because they would then need to initiate cardiac screening for you appropriately depending on the cause of that sudden event.
On our website, actually, just this a couple weeks back, we had a blog post. We started a blog, so on our website, if you go to Our Voice,
Mhm.
we have a couple of posts on there, and actually, one of the first ones was about family history. So there's some incredible resources and forms and
Yeah,
ways for you, questions you ask yourself and have ready, that
that's
you can
very
share with
helpful.
your family and actually get information from your family members. So that is on our website for anybody who needs it.
Yeah.
Um, I think the next piece, once you know your family history, can you recommend some screenings? As you know, what kind of tests should
Yeah.
I be getting?
So,
And what do those tests look like, right?
yeah,
Sometimes not
yeah.
knowing it's scary.
Yeah. So, it would be now because I'm a cardiologist, so mine is more specific to cardiac screenings, and so now let's start young. Let's start right from kids because, you'll see. So for example, if there's a history of high cholesterol in the family and, coronary artery disease, premature coronary artery disease, say the father had, has been on lipid lowering medications in his 30s, or things like that. The typical screening guidelines was to have two screenings done, one at around 8 to 10 years of age, then another one in your mid-teens. Okay. This is normal. This is a
Really?
normal that people do not do, sadly. Okay.
Yeah.
But if you have a history like your father had a heart attack at 40 or things like that, then you would actually fall into the category where you should get your screenings even earlier than 8 years of age. Okay. And that's because research has shown the earlier we intervene with these kids, usually the FDA has not approved lipid lowering medication for children, um, unless absolutely like they have a genetic, really bad kind of cholesterol genetic mutation, which amplifies their cholesterol levels. So they don't approve it below the age of like, say, 10, 8, 10, but we can use it for certain kids with extremely high numbers. But the whole point is to intervene young so we can at least adjust their diet and lifestyles and emphasize that, to the families to prevent early onset coronary disease. And so that's something that people are not doing on a routine basis. And even sadly, the pediatricians are guilty of not intervening young
You broke up for a second, Sumbal.
to pediatrician. Hey, don't forget his father, had a heart attack at 38, don't forget to do the lipid screening kind of thing, because that is very important because the graphs that you see in event rates really change once the intervention starts young, and so that's one thing I just wanted to emphasize because I don't think people know that their kids should be screened as
I
young
had
as they
no
should,
idea.
yeah. So, and then when you come into the adult life, then basically, so if you have no significant cardiac history of, a high cholesterol in your family and you yourself, your initial numbers may have been normal, as you're in your teenage years and stuff. So they typically recommend around 5 years or so to do your lipid screening. However, if you have again you've had high cholesterol or you've had a significant family history, your screenings then need to be done pretty much yearly in that respect, just to kind of follow your numbers and make sure that whatever interventions you are doing are working, with children, actually, if the numbers are high, we actually repeat it every 6 months. And of course, if you are on medication, then the guidelines change completely. You may need more frequent screening because of the medications. You have to monitor that. So those are like the basics for, like to prevent coronary artery disease, for example. And then your blood pressure should be checked on every doctor's visit. And that, multiple things that you need to watch out for. And I keep telling families because I notice blood pressures being taken incorrectly. Sadly, even in doctors' offices, they're not being done correctly, especially on children. And one of the biggest things is to use the right size cuff when and don't please use the wrist ones or, use your watch. I saw someone showing me their watch the other day. I was like, no, that's not how it works. You need to a blood pressure checked on your arm, and it has to be at least 2/3 of the way the width of your arm from your shoulder to your elbow. So if you see someone using a cuff from the wrong side, they're just gonna probably give you high blood pressure, which is inaccurate, and then if you do have consistently elevated numbers, then it needs to be checked manually as well to confirm. And those need to be followed. And this includes your kids, by the way. So your kids should be checked on every single visit. Their blood pressure needs to be
What's a
checked and
good
monitored.
number? What is a good blood pressure?
So the American Cardiology, the College of Cardiology actually dropped the normals that they were using as cutoffs for hypertension. So I think it was about 2 years ago. Before, they used to tolerate a systolic number around 130 and your diastolics up to 90. But now they've dropped it to the 120 over 80. And this is, I'm talking for adults. For children, it varies completely because it depends on the age. The variables for children, we have actually a growth chart for hypertension in children, just like you have for height and weight. So we go by the age, sex, and the height of the child to determine what their normal would be. And then we determine whether they're in normal, pre-hypertension, stage 1 hypertension, or stage 2 hypertension. And then treatment goes based on those ranges that they're consistently found to be in. You cannot diagnose a patient with high blood pressure on one visit. I want to emphasize that, okay? Because sometimes you have, you're scared, you're nervous being in a doctor's office, you have a little bit of anxiety, which we call white coat hypertension. So the best way to judge is over a period of time. Protocols usually suggest 3 visits, and see over 3 visits what the numbers are ranging for that patient. And then we will intervene and consider that patient hypertensive. Of course, if you end up in the ER with super high numbers and you've been ignoring symptoms or things like that, then that's a whole other situation. But hypertension is just not diagnosed on one visit, and you should not be started on therapy just after one visit. So those are like the main things that you really, from a cardiovascular standpoint, should be focused on. And of course, then other co-risk factors like diabetes or, any kind of hormonal issues, things like that can all play in. Some medications that you may be taking for another, like you have rheumatoid arthritis, taking steroids, your steroids will have an effect on your cardiovascular risk because it can increase blood pressure and increase cardiovascular risk. So, those are the kind of things that you need to, that's where the doctor comes in to personalize your screening, because depending on, if you're a complex patient with diabetes and, you're on a steroid for some other thing. And so your screening guidelines will be different.
Yeah, thank you so much, because I think, like, I have high blood pressure, and I think just I need to talk to my daughters about,
Yes.
what kinds of tests they should be telling, their when they go to their doctor's visits. What should they be telling their doctor about what I've been through, or how is it relevant, things like that.
Yes. And I think it's really important to emphasize because, how they talk about silent killers,
Mm,
and for the most part, a lot of patients with hypertension do not feel much. It's
yeah,
very, once in a while they'll get a headache or things like that. Even with really high numbers, they would have to be pretty high to kind of start causing
yeah,
headaches. But we need to emphasize the why. Okay.
mm,
So, and I think people don't understand what they end up doing is they end up, with their 10-15 minutes with their doctor in the office. They're like, oh, your high blood pressure, we can't have your blood pressure high, you need to, then you leave the office and you don't know why is my blood pressure not supposed to be high?
yeah.
And this is what I start educating my kids on young I'm sorry, my patients. I always call them my
Very
kids.
good.
Young, because I need them to understand why we're doing this. Like, why am I asking you to come back every so and so time? And why am I checking your blood pressure? Why am I having keep you on a blood pressure diary? Like, why am I on top of you so much? Like, to lose weight or to, diet, or, what is the reason? If you don't have a reason for that, you won't really be committed to it. And so I just want to emphasize the reason why hypertension is such an issue. And I'm going to speak specifically to the heart, okay? Is like, if you imagine, the heart's a muscle, okay? So the heart is a muscle. Now, when you go to the gym and you lift weights or you do resistance training, what happens to the muscles in your arms or your muscles in your legs? What happens? They thicken, they
Yeah,
get
they get
bigger, okay?
tight, and yeah,
So if your heart is pumping against an increased resistance, imagine how many beats a minute, and then how many minutes in a day, how many hours, and your heart is pumping blood out against a elevated resistance over a period of time, what's going to happen to that muscle? It's going to start to thicken, okay? And then over time, it can only compensate for so long before it starts to enlarge,
Yeah.
okay? And then that's when you start really getting into the bad stuff, with potential heart failure. Obviously, there's stroke risk. If it's really high, you can pop a vessel in your brain and things like that, and hemorrhage, and those kind of things as well. But I just want to emphasize that is why we follow, because you get one heart in your lifetime, and you need to take care of that one heart. You don't, like, you have two kidneys, you have, two eyes, you have one heart. So, and that, without that, you're in big trouble. It can cause issues all over your body.
Are
And
these
so
things reversible? Like,
so yes, so you can, once you reduce the resistance,
mm,
the heart can, um it depends on how long, though. I will say that it really depends on how chronic the condition has been. Because sometimes it will cause permanent damage, but you can kind of get back some of your function, especially in children. It's amazing. I've had babies with hypertension for other reasons, little babies. I've had a premature baby I was treating for hypertension, due to secondary cause. And, her heart was enlarged already, thickened, and all of that. And literally, once we grasped the control, we were, back into a completely normal baby, normal heart and everything. And once that her blood pressures were controlled. So children are super resilient. However, usually adults, it's usually a condition that's been happening over years and years and years. So obviously there will be some permanent damage, but yes, you can bring back some of that damage and control and avoid events,
yeah.
cardiac events in the future. My grandmother died at 35 from hypertensive heart failure. So she was only 35. My mom was just a teenager when she lost her mom to this, because it was not diagnosed, it was not treated, and it was quite severe. And so the only time she ended up going and finding out was when she was already in heart failure. So this is something I've actually seen in my family, like, and our family's experienced firsthand.
Yeah. Wow, I'm so sorry. That's,
Yeah.
I think with these kinds of things make you who you are, right? It's something you care deeply about, and
Right.
that shows. But
Yeah.
your why is kind of important. I think when we have family members that are affected by something,
Yeah.
then it really makes us want to take action. And I think so many people have been impacted by heart disease,
Absolutely.
by a parent that has passed away from heart disease. And sometimes, not knowing what they can do to prevent that from happening,
Yes.
is so dangerous, so dangerous.
Yes.
I'm really happy we're having this conversation. Sadia, did
Yeah.
you have any questions you wanted to ask before we move on to the next part?
No, just mainly if we can touch upon like like simple words for the women watching, what the main symptoms are that they should look out for or think, let me go to the emergency room. Because I've noticed, especially in our community, we don't take it as serious. It might be a digestive issue, it might, it might be a
Correct.
gas issue, let's just leave it alone type of thing. That's one point. And the other thing, again, I wanted to mention that I see when I was doing my clinical rotations and everything in Detroit, where we have a lot of our community, again, is the family history, is where I was noticing that when I was asking them the family history, a lot of people were trying to hide it, like they were, trying to show that, we're perfect, there's nothing wrong.
Oh, wow.
So when I was asking about the parents, they wouldn't say, yes, he died from a heart attack, or yes, I do have cholesterol in my family. They'd be like, no, we don't. And so I think that's a conversation we should have too, is that it's not something to be ashamed of. It's something, that we should talk about. We're at the doctor's office and they're the ones who are going to help us. So those are 2 points that I wanted to just bring up briefly, especially the one about the symptoms that we should not be ignoring. Because as women, we're so busy and we're doing so much that even if we feel a little ache or pain, we're like, it's okay. And I see women who even come to the cupping clinic who just have been living with it for so long, like any kind of pain, right? But especially heart health should not be ignored at all. So that's something that we should be aware of if we're getting any type of symptoms, to quickly go to the doctor or the emergency.
Yeah. And I think also like this idea that, oh, I don't want to be a bother. Like, look, don't worry about it.
Yes, that's the main
Like
point.
I
Yes.
they might find something and I can't deal with that right now. Like
Yeah,
so many people I know will not go to the doctor because they might find
exactly.
something.
Or they might not find anything at all, and I'm
And
going
then it's
for
a
no
waste of
reason.
time. Yeah.
Yes,
So what are
exactly. So
those? I think that's such an important question. Sumbul, can you like touch on
Yeah.
um, just what does it look like
Yeah.
and feel like?
So obviously, obviously the most common thing that you would hear of is chest pain, right? So the chest pain in cardiac pain, okay, is usually centered in the middle of your chest, okay? It's pressure like it's a squeezing sensation. So what you will see a lot of times people will gesture like this, you know? So they'll get a very kind of a squeezing sensation, pressure like discomfort, like something sitting on their chest, that kind of sensation. Now, if this is specifically happening, or not specifically, but particularly happening during physical activities, that is a little more concerning, you know? And so that should not be ignored. So, say you got on the treadmill and you were on the treadmill and you're constantly feeling this nagging discomfort, and sometimes it can be very vague. It won't feel like a really significant pain, but it's a nagging pain that you will feel every time you do some physical activities, and that's not necessary. If it's more advanced, you can get it at rest as well. Waking up in the morning is notorious where you hear people having cardiac events first thing in the morning. Okay. The other thing is radiating pain. So for example, if you feel some discomfort and then it radiates over to your arm or up to your jaw, that's a concern as well. Now, the one that's a little tricky is the indigestion. Okay, that people will say that, oh, I'm feeling some indigestion. Now, if this is a recurrent discomfort and it's not responding to like basic treatment, I would 100% go into your doctor's office and make sure, or if it's significant discomfort, I would go into the ER and make sure you get at least an EKG done, just to, especially if you have a family.
Sumbul, you're breaking up.
They will disregard that, but that should never be
Can you,
disregarded.
Sumbul, can you repeat what you said just a minute ago
Dismissed.
because you were breaking up? So just if you can repeat that.
Oh, I apologize. Okay. Which part, the indigestion?
Yeah, we got most of that answer, but just like what not to
Yes.
ignore. Yeah, so
They
if you
need to
just
go to their primary doctor, or if it's significant and really uncomfortable, they need to go to the ER and at least get an EKG done, okay? Just to make sure there are no changes or there are any concerning findings, consistent with having an ischemic event, or a heart attack is basically a diminishment of oxygen being delivered to the muscle of the heart. And so we see findings and changes on an EKG, which can show us that many times. Okay. And also, if you consistently have discomfort and a significant family history of it, please don't ignore if your initial tests are normal. Please go back again and get retested too, because this is another thing that you go in right at the beginning, the tests look good, but then the pain and the discomfort continues. Please go back again. It's okay. That's what our medical teams are there for. Please go back again and help us help you. So if it's not getting better, then maybe sometimes with progression of disease we're able to find things more clearly.
how
So
long, you mentioned to go back, how long after should they go back if they're still experiencing the symptoms?
Well, it depends on the severity, or on the consistency. So if it's like consistent discomfort, say you went into the ER one day, but it's consistent where you can sleep at night, you need to go in. You need to go in the next day and see it.
Okay.
Remember, cardiac changes, ischemic changes can happen within minutes,
Yeah.
and so it really depends. So if you went into the ER, you were feeling, say, a 4 out of 10 discomfort, okay?
Mhm.
And then by the evening you went in and you're now at 6 or 7 or 8, even then I would go in, so I would look for progression and look for the consistency of the discomfort, and those two things should be a more acute, you need to address it more acutely. However, if it's here and there, it comes and then goes, and then it's like you had it one day, then you didn't have it for a day, then you had it again, then I would say it's still worth going in and getting yourself rechecked despite therapy or whatever was suggested.
I've had a couple of ladies over the past couple of months that have come into my clinic to get the hijama and cupping and everything done, who have, like when I go through their health history and everything, they always say when they feel really stressed or when they feel angry is when they'll feel chest pain, and it'll sometimes even radiate to the left arm,
Mhm.
sometimes even go towards the back. Is that a sign of something, or should they be
They,
going in? And this is
no,
off and on for them.
yeah, but they should at least get a basic cardiac workup done for that, because
Hmm.
remember, what is stress? Stress,
Hmm.
you are kind of, it almost imitates exercise in a way, in the pressure and stuff that it can
Heart
elicit
racing.
those kind of responses. So absolutely they should get checked, and they should get a cardiac workup done. And like I said, where you will go will be determined on the acuity of the symptoms, how quick onset it was, and also how persistent those symptoms are. Okay, because some people, yes, you can wait for your primary care clinic to open in the morning. Others, no, you should go into the ER and get checked, because it's not worth the risk of missing something.
Yeah.
Okay.
Thank you so much.
Thank
And we wanted to keep this conversation not too long, so I wanted to end our conversation today with going back to that prevention piece. What are some lifestyle changes that we can make uh, to prevent things from getting that bad, right? Or um, to prevent cardiac disease, or if we're living with some kind of cardiac disease, what are some lifestyle changes that we can make to make it not worse? So there's so much that is in our control, like you mentioned in the beginning, that we may be able to deal with without resorting to taking medication, right? So
Yeah.
what are some lifestyle changes that you recommend for people who want to prevent heart disease?
Okay, so it's basically three things, okay? And it's sleep, which people don't talk
Oh
about,
my gosh, are you serious?
diet, and lifestyle, okay?
So
And
sleep, diet, and lifestyle.
because I'm saying sleep first because that's the one that's most ignored, and people don't realize how important that is for general health. If
Wow.
you do not give your body time to regenerate itself, to have that quality sleep, issues for you.
So when you
And
say
so,
you're breaking up for a second, Sumbal, I'm
mhm.
sorry.
Sorry, you were saying?
Yeah, how many hours does that mean? Like 6 hours, 8 hours? What is a good night's sleep? Or is it different for everybody? Oh, Sumbal broke up again.
Oh, I think maybe.
You're back.
Oh, sorry. I don't know what happened there.
You just disappeared. No, I
Yeah.
was asking like what is a good night's sleep? What do you mean? Like how many hours does
So at least 7 to 8 hours, okay, is what everyone should be getting. Now, the thing is also not even just the duration, but the quality of the sleep. Okay. So, for example, if you are snoring a lot at night, you need to bring that up to your primary doctor. Okay. Because that can sometimes impede oxygen flow. All right. If
Mm.
it's significant, and you've heard of sleep apnea, and things like that. So, if you're restless, you have issues with the quality of your sleep, please, please bring it up to your doctor, because it can lead to things like high blood pressure and things like that just from lack of sleep, because that's one of our screening questions that we ask children, especially who have end up with high blood pressure, because high blood pressure in children is not normal at all. So one of the screening things we ask is about sleep, and so it's just so important to give your body that rest. Then, of course, diet. We talk about diet quite a bit. I know that people are now emphasizing more plant-based foods, less animal derived foods, things like that, and whole grains, high fiber diet, lots of water. And any carbohydrates you have should be complex carbohydrates, so like whole grains, things like that, versus, anything white, like white bread and white sugar and white, anything processed as well should be avoided, because of the preservatives that they use in those things. And like I said, and you must have heard of this about shopping in the periphery of the supermarket, not in the middle of the supermarket,
Mm.
where most of the preserved foods are. go try to buy most of your produce from the fresh food aisles or from frozen versus, the tinned and canned foods. And that kind of would be just a general guideline for you. And then exercise 30 to 40 minutes at a minimum 5 days a week. And the activity should be such that moderate activity. So what that means is that you cannot speak in full sentences comfortably during the activity for that 30, 40 minutes. Okay. So you sound breathless, because remember, everybody's intensity will be different. Okay. Because it depends on what kind of lifestyle you've had. So if you've been active, your tolerance for a certain degree of activity will be much better than someone else who's not. So your tolerance will be judged by, just a rough kind of a way for you to assess is that you are breathless when talking, and that means you've reached a good intensity for your exercise.
Is this the same for if people do have some kind of heart condition?
No, so that's a whole different situation.
Because I'm
So
thinking running out of breath and stuff may not be
yeah,
good for them.
prevention. So
Okay.
I'm specifically talking for people who do not have diagnosis.
Okay, good. Just wanted to clarify. Yeah,
Yes. No, this is for people who have no known
got it.
cardiac issues at that point. This is just prevention.
Got it.
Of course, if you have heart failure, you are going to get short of breath after maybe
Or
even
going up
just.
the stairs. Yeah.
So that's a whole different
Yeah.
guideline for those patients.
And for that, you have to just talk to your doctor and find out
Correct.
what
Because
physical activity is okay for you.
it has to be personalized. And
Yes.
then we have to determine, because there's some patients that we don't want them doing any physical activities, things
Yes.
like people with hypertrophic cardiomyopathy. We don't want them raising their heart rates too high. And so, those are patients that we're very careful to limit their physical activities,
Yeah.
So yes, absolutely. I'm
That's why I
talking.
just wanted to put a disclaimer out there. Like, oh no, I want to fix my heart, I'm going to run. No.
Yep,
Yeah.
absolutely.
Okay, great. Okay, awesome. So sleep, diet, and lifestyle. And I think with Ramadan coming tomorrow, tonight, those are three things sometimes that are really, really hard
Very
because we do
hard.
not sleep, because we have to go to bed after iftar tarawih. We have to
Absolutely.
wake up before Sahri and then go to work. So I
Yeah.
think maybe taking a nap,
Yeah.
if you're able
Yeah.
to, and then when it comes to diet, everything is fried and
Yeah.
biryanis and white rice and so
It's so important. Make sure that you get the most bang for your buck. And what do you get to eat during Ramadan? In the morning, just be very cognizant not to eat anything too heavy. So maybe focus on foods like whole grains. One thing I find amazing is avocado in the morning, because I feel like it stays in your belly. You feel full and it has great nutritional value. And so, if you're not dairy, then yogurts may not be good for you. But, if you are, then, you can also, do kind of Greek yogurts and things like that. And,
oatmeals also really work. I think
oatmeal's fantastic.
with
Yeah.
bananas and some dates chopped
Yes.
up, you have potassium.
And nuts, get a
Yeah.
handful of nuts, and stuff. And all of that is great. And then after iftar, really, I see the thing of eating twice. You don't need to. You can just have dinner and just have
Yeah.
your regular dinner
Especially when
at.
it's late. Yeah.
Yeah, because people want to treat themselves because they've been so good for
Yeah.
12 hours and they want to give themselves some treats. But, you're actually taking away the benefits of what you just did, to
Yeah.
your body, which was
Yeah.
so beneficial. The fasting is so beneficial. It's anti-inflammatory. It's so good for
Yeah.
you. But, then they go and then they grease it up.
Yeah.
Yeah. I think that all the fried food is actually harming your body after being hungry
Correct.
for so long. So
Correct.
what you put in your body after all that fasting really, really helps or makes a difference.
Yeah.
I think
Find some vegetables to put in there somehow, like
Yeah.
I
yes.
think it's
Or at
really
least
hard culturally, right? Like I grew up also like 5, 6 things for iftar,
same
right?
here.
And
Yeah.
the fried stuff, like so many things. And
Or
Yeah.
at
then
least the first thing we're eating
you
should
have a
be
bunch.
something healthy that's going into the
Yes. And
stomach and into our
Yeah.
body.
so many cultures do have that, but I think
Yeah.
Yeah.
my culture did not have that.
Yeah.
Yeah, so we do these in our house. So we open it up with obviously water and date, and then we do a smoothie before going for namaz. And so that's so good because it's also filling. You tend not to eat too much right after,
Exactly.
but we'll put spinach and ginger and strawberries, bananas, blueberries, and all of that into that one drink. And then we will have that, with sometimes with yogurt or oat milk or whatever. And it's such a good way to start because we're getting our veggies in, we're getting our fruit in right
Absolutely.
away first. And then we just have a regular dinner. That's basically what we do. And we'll make it a little more special, but we won't make it very heavy, because that feeling is also not very good right
It's
before
really
Tarawih.
not. Yeah.
You want to pass out during Tarawih.
Yeah. Yeah. So thank you so much
Uh,
for all of
You.
these reminders. I think um there is so much that we may need to do differently. Like I know I do. Like there's so much, and sometimes it can be overwhelming, like
yeah,
changing your whole life. So maybe, what are the key things? How can we make small changes and slowly build on them?
yeah,
I think it's just really important to know so that you can slowly, slowly, slowly start
Yeah.
changing. Yeah.
And please, I just want to emphasize family history is so important.
Yes.
Prevention. So please talk very openly and very clearly to your doctor about your family history because it will give us a lot of help in determining whether you need to be kind of pulled out of your routine screen kind of guidelines and into a more detailed, kind of testing area, because it's a whole different situation if you say your mother passed away of this and your dad passed away of the same thing, and then it's a whole different thing,
Yeah.
for that kind of a history versus something where someone who has absolutely no history of anything.
Yeah. Thank you so much. Sadia, any final questions?
No, Dr. Sumbal did a very good job covering everything. So I want to thank you so much for your time today, Dr.
Thank you.
Sumbal.
Yeah.
Thank you so much.
I agree. We kind of covered a little bit of everything. It was so
Yes.
comprehensive. I really appreciate your time.
Yeah.
And
No,
we
of course.
will be
Thank
sharing
you.
all of these resources and more on our website and with the different posts. So I really appreciate everything that you've shared, and we will spread the word and pass this along and talk to people. So talk to your friends about this kind of stuff. If you're
Yeah.
watching, just oh, I just heard a podcast and hey, we need to do this. I think it's important to just spread this really important information. So thank you both very
You.
much
Thank
for
you
your
so much.
time.
Okay,
Um,
bye.
Thank you.
thank you so much.
Allah
Bye.
Hafiz.
All
Allah Hafiz.
right. Bye.
Assalamualaikum.
Bye. Welcome.